Hello, my name is Erin Rayford, and the following presentation is my research project proposal concerning the benefit of the influenza vaccine in people with chronic lung disease. After initial research on the broad topic of vaccines, I developed the following researchable question. In adults with chronic respiratory disease, does compliance with annual influenza vaccination result in decreased episodic visits related to their chronic respiratory disease diagnosis throughout the year? Chronic lung diseases is a general term that encompasses a group of persistent pulmonary disorders. Asthma, chronic bronchitis, emphysema, chronic obstructive pulmonary disease, or COPD, cystic fibrosis, and obstructive lung diseases are the most frequently addressed lung conditions. According to the American Lung Association, there are nearly 32 million Americans living with a chronic lung disease. These persons are more susceptible to experience generalized respiratory symptoms such as cough, shortness of breath, increased mucus, and sputum. They are frequently affected by common bacterial and viral infections, leading to the exacerbations of their underlying lung disease and impaired lung function. Exacerbations lead to further deterioration of the pulmonary system, increasing the probability of complications of lifelong debility. In fact, research of the American Lung Association suggests complications associated with chronic lung disease is the third leading cause of death. Chronic respiratory diseases are statistically significant within the United States population. According to the CDC, of the 3 million Americans residing in the United States, 15 million Americans have been diagnosed with COPD. In 2011, Georgia residents alone made up 1 million of this population. Chronic lung diseases are progressive, and nearly half of the affected adults are unaware of the disease, including the extent and overall pulmonary function. The realization of disease typically does not present until the person has an exacerbation and is seen by a healthcare professional. Exacerbations of chronic lung diseases cause the airways to swell and increase mucus production, resulting in frequent coughing or wheezing and shortness of breath. The causes of exacerbations are multifactorial, and at times it is hard to determine the primary causative source. Poor air quality and respiratory infections are thought to play the largest role in exacerbations. Respiratory viruses are known as common triggers of respiratory conditions that result in outpatient treatment or hospitalizations of patients with chronic underlying conditions. In a study of COPD exacerbations, 30% of cases identified a respiratory virus as the causative agent. Upper respiratory infections and their respective associated symptoms and complications are the leading cause of outpatient visits, highlighting the need for effective vaccine coverage for these potential debilitating viruses. Without proper vaccination and preventative health measures, the increased occurrence of exacerbations can lead to detrimental long-term effects. As of the last 3 years, the mortality rate of COPD exacerbation is 8%, and patients with frequent exacerbations related to respiratory viruses have a mortality rate of 23% per year. The intent of this research is to further explore interventions among individuals with chronic respiratory disease with the aim to promote self-care and decrease the rate and severity in which they experience exacerbations of their disease. The project design is a retrospective quantitative chart review seeking to evaluate an additive benefit of receiving an annual influenza vaccine in people with a compromised respiratory system. Convenient sampling with inclusion and exclusion-based criteria will be utilized to investigate the potential relationship between influenza vaccines contributing to fewer or less severe respiratory exacerbations and complications. The medical chart review will begin with identification of a person with a known medical history of chronic respiratory disease. Inclusion of both males and females will be used within the study, but must be aged at 60 years or older. The age, sex, ICD-10 medical diagnosis of respiratory disease, tobacco history and use, occupation history, employment status, and influenza vaccination status will be recorded. The purpose of reviewing medical records is to 1. Reveal if they have received an influenza vaccine between the months of September to December during the previous year, 2. The number of acute office visits during October to February. 3. The number of office visits related to an exacerbation of known respiratory illness. And 4. The ICD-10 documentation of a flu or acute respiratory illness. The goal of the project is to acknowledge the prevalence and increase the basic knowledge of chronic respiratory disease and adequate self-care management to maintain a person's health and overall well-being during their lifetime. The knowledge benefit of the project is equal among individuals with chronic respiratory disease, individuals who may experience acute respiratory illness, medical staff, and primary care providers. Statistical and numerical information will specifically describe the population at hand and directly correlate preventive measures and interventions to improve the health and quality of life of patients, loved ones, and other community members. Currently, it is of global recommendation to receive and improve vaccine coverage, especially among patients with compromised body systems and chronic diseases. Therefore, the background research and study findings will be used to develop an informational brochure. A brochure utilizing statistical findings from the study presents the information in a more personable, relatable, and realistic manner. This pertinent information would be a vital aspect in the education process to inform, raise awareness, and promote compliance with annual influenza vaccine with the hope to achieve better patient outcomes for people with chronic respiratory disease. I thank you for allowing me to present my project proposal to you, and I look forward to disseminating the final results in April.